anyway. But the GP would recommend that you give your child inhalers. Now, what can you give instead of inhalers? You know, what is it that you can do for your child? The doctor's not giving any antibiotics. They're telling you to just give cough medicines and that's it. But you know, what can you? Is there anything else? Yes, there is. There's a lot that we can do and give for children or adults when they have these coughs. So I'm going to say a few names. For those of you who are familiar with homeopathy, you'll be aware of some of the names, and if not, obviously you guys are free to contact me any time, and then I can always make some suggestions. Now, if you want to ask me any questions or you would like to join live, take part in this show, my telephone number is 0758 723 7002. So please feel free to give me a call or drop me a text message. I think a lot of you prefer to drop the text messages to remain a little bit anonymous than doing the live call. We had a few callers in the first show, but you know, feel free to give a call and ask any question that you would like to ask. Okay, so your child's got a chesty cough. What is the remedy? What is the main remedy? Chesty cough often indicates phlegm that's in the chest. Now, the phlegm that you have, ideally it should be flowing. You know, when it starts to become blocked, that's when there's complications for the child. So you know, we are looking to clear that and get rid of that. The main remedy, one of the main remedies, is Antymtart. Now, Antymtart is a great remedy for a chesty cough, rattling cough, whether it's when the child's coughing, yeah, or when they're just lying down and they're sleeping and you can hear the rattling while they're breathing. So Antymtart is a great remedy for that. Then you've got a dry cough often with a bit of a temperature. There's a couple of remedies that you know would be ideal for that. One of the main ones is bryonia. That's a great remedy. And another one is dulcamara. Again, different symptoms and taking a little bit more of an in-depth history as to why the cough happened. You know, is it aggravated by cold weather? Is it the damp weather that's aggravating? Then something like dulcamara would be good. You know, does the child want, or adults? Sorry, I keep saying children because I'm dealing with a lot of children these days. Does the person you know want to rest, wrap up warm, are they thirsty? You know, these type of things would then indicate bryonia. And there's quite a few other remedies, so I'm only giving you sort of the main ones, but you know, after having a consultation and talking properly, then we would be able to identify the exact remedy. And if we give the right remedy, then very quickly a child or adult should receive benefits from the treatment. Okay, we're moving on to a barking cough, actually, which is what Angela talked about. It's a barking cough. The barking cough is that, as it is in the name, like it's sort of such a deep, hoarse type of cough. And it produces this sound, or you know, because it's sort of bordering on cough and laryngitis. For that type of cough, you're looking at spongia. It's a great remedy for that. So Angela, that's a remedy that you would be indicated for what you described. So you know, you can take that in say maybe a 30 potency. Now you've got the nighttime cough. I get this quite a lot. The nighttime cough is the most disturbing, especially for parents if their child has got a cough at night, because often the child might cough and cough and cough and then they make themselves sick. And you know, no matter how much you elevate them or whatever, you know, it's difficult for parents to manage this type of cough. Now, there's many reasons for this type of cough. Again, there's lots of remedies which are indicated. Again, bryonia, nux vomica, lycopodium, hepasulfa, could be any of these. These are just to name a few. Now, basically, there can be two reasons why somebody has a cough at night. The most common is, okay, they've had a cold and the cough's been aggravated, and that's why they're coughing. But if the cough is more long term, say it's been a couple of weeks or a month or 6 weeks, this cough seems to be lingering, and there's no cough in the day and the cough's at night. Often that can be reflux, you know, believe it or not. So the silent reflux, as a child lies down, or even adult, but this is quite common in children because obviously they can't explain to you what the symptoms are and what they're experiencing. So they're lying down, and some of the milk, often when you know, little children are having milk just before bed, it begins to regurgitate up, and that reflux begins to cause a cough, because that's just the way the body's defense mechanism to deal with this type of regurgitation. Often I've spoken to parents, and just a simple remedy like, you know, giving milk a little bit earlier helps to relieve that problem. So you're not experiencing that problem anymore. Or, you know, we can give some remedies that could help settle down that reflux. And I do find there's a pattern that children who have this then also have a bit of a poor appetite in the day. So they sort of come out, that's an indicator that, yeah, this is the problem. This is why this cough is happening in this person. Okay, then we've got the wheezy cough. Yeah, wheezy cough is quite a common one these days as well, and quite alarming, especially in times of COVID. Parents can you know, be a little bit anxious if suddenly their child is developing this wheeze. Again, a lot of remedies for that. Arsenic kelp would probably be one of the main ones, and hepa sulfur can also be indicated for this type of wheezy cough. If it's, you know, a sort of damp weather that's aggravating, it could be Rumex as well. So it would be good for you to, you know, for something like wheeziness, to maybe have a consultation before you start using home remedies. Now, I'm all for people having homeopathic remedies at home and trying to manage symptoms at home. That's great. You know, it's great to be informed and know, you know, what you can give your child and what benefits it would bring. However, it's important to know that some remedies, if they're not indicated, can actually bring on symptoms. So it's always better to get advice. It's always better to ask someone and, you know, make sure that you're giving the right remedy. Okay, so I'm just going to see, I've had a couple of more sort of questions coming in, and the questions, again, this is a question which is not even related to what we're talking about today, but I will cover it. Sorry, I have to put my glasses on and read again. The person hasn't left their name. It's an anonymous one, and they're talking about piles. Can homeopathy help with piles? Yes, most definitely, because with something like piles, I'm going to digress a little bit, answer this question, then we'll go back to our colds and flus and things. So the main cause of piles is obviously constipation, or you know, a sluggish digestive system. Now, homeopathy is very, very effective at treating piles. So again, there's different symptoms of piles, so that would indicate a different remedy. So it's not easy for me to just give you one remedy. So there's a lot of bleeding. You know, there's phosphorus, hamamelis, you know, these type of remedies. Is there pain? Is there pain before the bowel movement, after the bowel movement? Is the pain sharp? Is it throbbing? You know, and is there protruding piles? All of these will indicate different things. Now, you know, we might sometimes take it lightly, think, okay, it's just a bit of pile, just a bit of constipation. However, I feel that it's important to treat something like that at the beginning, right at the beginning, almost like we say, nip it in the bud. Because these type of things, I get people who've been to the GP, they've exhausted everything, and then they've got themselves into a bit of a mess, and they've got a fissure. And even I've had people who then had their fissure operated on, and then come back. Becomes very complex, you know, for even us to treat, and it means longer term treatment. So I'd recommend that when symptoms happen, get treatment very, very quickly. Then you don't need to take treatment for a very, very long time. Now, I work, a lot of people probably know already, but if there's anyone who's joining or watching this video who doesn't know much about me, I used to work in pharmaceuticals for a very well-known company called Pfizer. For about 15 years before I retrained to do homeopathy. Now, one of my main issues was that I was dealing with chronic conditions when I was working for the pharma company, and I was finding a bit hard to accept that a lot of people who had, like, say, blood pressure or arthritis were going to be taking these medications possibly for the rest of their lives, you know. And these are things which, because obviously when you work in the companies, you're taught and learnt about the side effect profile of medicines, because they do, because they all do to some extent, because they're metabolized in the liver or the kidneys. So they do. And so my aim is always to give advice to people based on trying to get them relief as fast as possible, so they are not taking medications long term. Now I get people come to me and they say, oh, we went to this homeopath and we've been taking remedies for a year or 2 years, and I'm thinking, no, that should not be the objective of any homeopathic remedy. Homeopathic remedies are designed to give quick relief, and and come off treatment as quick as possible. An average treatment, I would say, is about 3 months for most things, but if they are complicated, then yeah, I do have some people like who've had fissures or piles who have even taken it for a year, or epilepsy or something like that. But generally, the aim is to quickly get people off medication. Okay, so if you want to call in or you want to message me, please feel free to message me on 0758 723 7002. You can do that now, or you can do that after the show as well. So let me just check to see if there's any message is coming through. I think there's a message on here, but I'm not being able to access. Okay. Would help if I was very technical, which I'm not, but I'm learning as I'm going along. So okay, so let's go on. There is a message from a lady called Harsha Kaur about tonsillitis, but I'm gonna Harsha, if you could just wait a minute, I'm just gonna answer that question in a minute. Yeah. So I'm going to go on to talking about just the nose side, and then I'm going to talk about tonsillitis. And I'm also aware of the time. So the time we are coming close to, we have about 10 minutes left. So if you've got any questions, put them through. If not, I'll deal with them in the next live show. I'm planning hopefully to do these on a weekly basis. So if you have any ideas, any recommendations of what the next show should involve, then please let me know. And I'll try and cover that. So we're doing coughs and runny nose and tonsillitis because we've had such a huge response from people to say, well, this is what's really bothering them. So runny nose, this is a common one now, especially with children. They go outside, they've been to school, the wind's blowing, it's quite cold, and they've got this runny nose, and sometimes even runny eyes, water coming out the eyes. They're snivelling away in the class and at home as well. So a good remedy for that is allium cepa, and also arsenic alb can also be indicated here as well. Now there's also the blocked nose. Again, blocked nose requires a little bit more information to be given, but there are generally remedies like calibicrome and even nux vomica and Antymtart. These type of remedies can help to relieve the blocked nose that a patient is experiencing. Some people might get both, a little bit of blocked and a little bit of runny nose, and also sneezing. So again, a lot of sneezing in the morning, especially when they wake up, constantly sneezing for 10, 15, 20 sneezes at a time. Something like arsenic alb would help in that type of situation. And I'm trying to move quickly through because I'm a bit conscious of time, because a big topic that people really want me to focus on is tonsillitis. Tonsillitis is something that parents become quite concerned with. The child is given antibiotics again and again, and the antibiotics are not relieving the symptoms, and they are relieving them, sorry, and then they have to then go back again. And I get people who've been on a course 6, 7 different types of antibiotics over the period of a year, and it can be quite concerning for parents to have their child go through that. Tonsillitis can again come in very, very different symptoms. So you've got red tonsillitis, just redness, and the child's complaining of a sore throat. You could have white bits on there on the tonsillitis, or you could have both. Or also the tonsils could be a little bit inflamed or enlarged. And now all of these would give different remedies. So if the child's just got a simple red, red throat, red sort of tonsillitis, then something like belladonna is a good remedy for that. If there's white spots on there, or yellowy spots on the tonsils, then you're looking at something like pepper sulfur. And if they've got that and they've got a cough as well, then you might need to do a combination, or possibly spongia and pepper sulfur, a combination on all of these, the runny nose as well, and allium cepa. So then it's better to get advice, because when we prepare the medication, we'll prepare a combination for everything, those symptoms. So it's fine when there's one symptom on its own. It's easy for you guys to manage at home, but sometimes when there's 2 or 3 symptoms together, they can become a bit confusing as to, gosh, which one do we give, because there's a barking cough, and there's a runny nose, and the redness on the tonsils as well. Then it can become a little bit confusing for people, so please get advice on that. Now, a good mix sometimes, if there is some tonsillitis that has come up, is make a combination of say aconite, pepper sulfur, spongia, mix it together. Again, we have combinations here ready that we prepare and we can send out to you, and help you have relief from that. And definitely, we can prevent a lot of people from having surgery or tonsillitis as a result. We can prevent that. I've got another message coming through. If I just have a look at that before we go ahead. Okay, so we touched on this topic. We've got a call from a message coming through from Seema Dillon, and she's saying that she's really disturbed by her young 5-year-old who has got a night cough. So at night time, he's coughing and coughing, and then he's making himself sick. So firstly, what I would say in that type of situation is elevate the bed slightly. So if a young 5-year-old, if you put a couple of pillows under the mattress, so the child is in a slightly elevated position, and then you can give, depending on the type of cough, whether it's dry, possibly I think it would be better if you give me a call offline, and maybe tomorrow morning now, because it's quite late this evening, and I'll be able to give you suggest a few remedies for you, and definitely this will help. I need to just ask a few more questions as to how long you've had this cough and what's going on. Okay, so let me just have a look if there's any more messages coming through. Otherwise, we're coming to the last 5 minutes. And if you've got any more calls, then please feel free to give me a call, or you can message me in time for next week's. Just 1 second, if I can just get back onto. Oh, this is not going. Okay, that's fine. I think that's all the questions I can cover now. So we've only got a few minutes left, and there's so much more that I wanted to give information to you about. So many other things relating to coughs and colds, and throat infection, and tonsillitis, allergic rhinitis, sinusitis. So many different topics, but I think I'm going to. The coming weeks, I'm going to cover a few more of those in detail. So please, if there's any questions, feel free to message me, and I'll deal with them. If it's complicated and you feel, gosh, you need to get some advice, then please message me on 0758 723 7002, and I'll be able to let you know. I've just had a quick message before we go from a lady who says, I have nose blocked since a year now, please help. So yep, that's Hansel. I'll answer that question. Nose blocked for a year, as I mentioned previously, would definitely indicate some digestive disorder from within. I don't know if you've got a bloated stomach, I don't know if you have heartburn, you have reflux, you know, these type of things then begin to regurgitate up and you start getting symptoms around here as well. So yeah, definitely, you know, a simple remedy that you can try, which you can buy over the counter in a lower potency, is Nux vomica. However, I think if you've had it for 1 year, we probably need to give you a little bit of a higher potency, which you won't be able to buy over the counter. So please feel free to give me a call. And there's a combination of a couple of other remedies that we normally put in our medication, which will quickly give you relief from that, you know. So yeah, and that's I hope that's answered your question. And if you've got any more questions, then my number is 0758 723 7002. Please just drop me a message and or give me a call tomorrow morning after 9 o'clock, and I'll be able to you know, be able to talk to you in more detail and give you more precise advice about that. So yeah, we've covered quite a lot today. We've talked about coughs and colds and yeah, that's just a thanks. Sorry, I have to put my glasses on every time I ask a question so I can see fine, and then to reading I have to put my glasses on. So sorry to keep popping on. Okay, so it's been great today. Thank you so much for everybody who's joined me. We just have a couple of minutes left, so I don't want to keep summarizing everything again. I've been through everything. If you like the video, please press like, and it shows me that you'd like some more information. And also drop a comment in the comment section if there's any feedback or any other programs that you'd like. And also please subscribe to the channel and press the bell button so you get notification every time I'm live. And your sort of, you know, encouragement that will encourage me to maybe do more of these lives on different topics. Thank you very much for joining me. I thought I went off then, but I'm still there. Thank you very much, and hopefully see you next week.